Hello, welcome. Today I am joined by physiotherapist Adam Meakins. Adam, how you doing?
Hi, Andy. Yeah, I'm very well, thanks. Thanks for inviting me on and look forward to the chat.
No problem. No, I've been trying to pin you down for a while now, so I'm looking forward to it.
Yeah, sorry about that. I said to you off air, I'm normally a bit more responsive to the messages, but life has been a bit complicated at the moment, so I haven't been as quick to respond to things. So I know we've been planning this probably 3, 4, maybe even longer months to try and get it done, but we're here eventually at last, mate. That's the main thing.
We're here, and I'm looking forward to it. So, what have you been up to today?
Today has been a non-clinical day, so Thursdays is my day for doing stuff for the Better Clinician Project. So I run an online educational company with a colleague of mine called Ben Cormack called the Better Clinician Project, which is the way I like to try and describe it, it's a bit like Netflix for therapists. So it's a subscription service, but we offer a wide range of things on there that they can peruse and look at. It's based around musculoskeletal health, but we look at not just pathologies, although that's a big part of it, looking at how to assess things, how to diagnose things, how to treat things. But we also look at, the general day-to-day life of being a musculoskeletal therapist and give people some support and strategies to help, with communication skills with patients, about the day-to-day stresses of running a clinic, about, sometimes the administration and financial side of it, as well as obviously the stress and the anxiety that this job can create as well, and how to deal with that. So it's an all-encompassing service, I think, for all musculoskeletal therapists, not just based on research of pathologies and rehabilitation exercises. So that's basically what I've been up to today. I've been editing some videos for next month's content that's coming out on non-specific low back pain.
Right. Okay. And then, so how did that project come about?
Yeah, quite an interesting story. So me and Ben, my business partner, we very much initially didn't see eye to eye. And I suppose you could still say we don't. And I think that's part of the magic that works well between us when we do it, because we do have some quite different views and opinions of how to assess and treat and manage things, looking at different perspectives. But on social media, we had quite a few run-ins, I suppose, for want of a better description. And I'll put my hand up here, I was partly to blame, and Ben was partly to blame in our tones and our mannerisms and our slagging each other off. And so we had this very much anti sort of relationship where every time somebody will post something, we would sort of do a little passive aggressive repost and subtweet and stuff like that. And we wound each other up quite successfully, I think, for about a year. And then, as it's quite a small world, we bumped into each other at a conference. We were both talking at this conference in the Netherlands. And, we keep giving each other the side eye and the glances at this conference. And long story short, we're in the bar. And after the conference, we're having a few beers and we started talking and we were trying to clear the air. And we did. And we sort of sat down and said, this is stupid. I think we agree more than we disagree. Let's put our swords down. Let's the water go under the bridge and let's leave it at that. And then from that, we started exchanging emails and messages and discussing things a bit more and started to grow a relationship and a friendship. And next thing we know, we came up with this idea of doing the Better Clinician Project.
Yeah, that's interesting. So when you get into one of those spats then, so it is quite interesting because I see, they go on, obviously not just with you guys, but like, are you genuinely irritated by what he puts?
Yeah, I think, yes, there is situations where, there are trolls out there. There are people that are deliberately provoking you for a reaction, and it does upset and wind you. But what I've realized being on social media now for God knows how many years, I lost count when I first started. What I've realized over the years is a lot of things are just misinterpretations. They are taking things the wrong way. And it's just the issue with the written word. You can't get sarcasm very easily. You can't appreciate people's tone. And so when you read something in black and white, it's very easy to misinterpret it. It's very easy to take it the wrong way. And so I think a lot of disagreements and arguments that I've had with musculoskeletal therapists has been because of that. Either my misinterpretation or somebody else's misinterpretation of what I'm saying. I mean, I had it with a thing today that I had to put a post out yesterday talking about how therapists really don't need a lot of the time to have a super specific diagnosis about why somebody's got pain, and how we sometimes, just we look at the patient, we screen them, we assess them, we exclude any serious or sinister pathologies to the best of our ability. But then trying to work out where this source of pain and symptoms are coming from is very difficult to do. Our tests are not that specific or sensitive to tell us one specific structure, one specific cause is the symptoms of their pain. And we also know patients present variably with the same pathologies. So no disc herniation will, in one person can present completely different in another person. So I put a post out there explaining that how I think a lot of physiotherapists really don't need to have a specific diagnosis when they help and treat people. It's looking at the patient's presentations and their problems. That's what we treat. We assess and treat people's problems that the pathology is contributing to. We don't actually directly treat the pathology, but there was lots of disagreement around it. Lots of people were misunderstanding what I was saying. And one of them was, oh, you don't think we should screen people for serious and sinister pathologies? And I'm like, no, I absolutely do. I'm not saying we stop assessing people. I'm just saying we don't need to be as specific as a lot of physiotherapists think. And they say it's just these things that create all this misinterpretation, misunderstanding. We start talking over each other rather than towards each other, and it just starts this snowball effect of resentment and bitterness and a little bit of anger and a little bit of frustration. And then it all starts going downhill quite quickly and quite rapidly. So I think, as I say, that's the biggest issue with social media.
And then, but there's obviously there's positive discussions that come out of these things as well. And what is your thoughts on social media and the impact it's had on the industry?
Oh, I think it's massive. I think in general, it's a thing for good. It's definitely had a positive impact. It's given us a much wider, broader horizon and spectrum to look at. It's opened all of our minds to alternative hypotheses and reasons. The downside of that is it's very hard to sift through all these different reasons and opinions to determine which ones are the more reliable and trustworthy ones. So it does require a lot of skepticism, critical thinking skills, analytical skills to use social media really well as a therapist. You can't just take anything at face value. But it does allow you to understand that there are lots of different views and opinions out there. There's lots of different conflicting research out there that you may have been totally unaware of before social media. And I think that's a good thing, not only for the therapist, but for the patients as well. And I say to a lot of therapists, the reason that I get involved in these discussions, in these debates, is not to change the other person's mind that I'm discussing with. It's just to give people watching and viewing a perspective to see that there's differences of opinion. There's alternative explanations and reasons and pathways that people can explore when they've got their pain. They don't have to go and have this manipulation. They don't have to go and have this spinal injection, because there's this other guy saying there's another way, there's another option that you could try and explore with research and evidence to back it up.
And so when you post something around that, what is the thought process, say, around the myths of X, whatever that may be? Is it for that reason to be thought provoking? Is it like what is the actual end game for you that you're looking for?
Yeah, I think, I play a social media game here from an engagement point of view. I'm not going to lie there. I do it to try and generate a bit of engagement and an increased reach and a following. So I do sometimes, use a little bit of clickbaity titles, stir the pot, a little bit sometimes unnecessarily, just to try and, tap into that social media algorithm effect. But, my main ulterior motive, my main agenda is to try and help improve the profession in general. I want to try and make the profession realize, that it doesn't have to do things that it was doing 20 years ago. It doesn't have to think the same way it was 20 years ago. And everybody says that, I'm being disrespectful here. I'm not appreciating the leaders, the thought leaders beforehand. I'm like, yeah, absolutely, I am. I am respectful of these people that have, had these opinions and things beforehand. But, you know, we need to advance. We need to move forward. And that means sometimes, you know, not trashing, but it sometimes means challenging and critiquing other people's views and opinions that have come before us. Doesn't mean I'm being disrespectful. Doesn't mean that I don't think they were trying their best in their situation at the time. But it's just now that we've got new information, we've got better understanding of things. Therefore, we need to try and move away from this approach and opinion and dogma. And it isn't easy, because I do find sometimes this profession gets itself very much in a comfort zone, in a rut, and it very much wants to stay there. It does want to carry on doing what it's always done, wants to take the easy path. And trying to change that isn't easy at all.
So one of the things which I always find interesting is when I meet people who I really respect and, you know, are good in the industry, they always seem to like qualify you to me as, oh, Adam's a good lad. Not just to me, to anyone. Adam's really good lad and he's really good at what he does. So yeah, you know. So like, what do you get in terms of reaction from people when you meet them?
I think the best way I describe it is a bit like Marmite. You know, I'm either, you know, people like what I do, they're on the same sort of wavelength, they like the fact that I'm giving them some sort of confirmation bias about, you know, how to practice and how to be a physiotherapist. And then there's others that can't stand the sight of me or the sound of me. So they very much don't like the fact that I am rocking the boat, challenging the status quo, and perhaps causing them cognitive dissonance and, you know, that conflict of emotions that happens when we get conflicting information. It can sometimes rock us a lot and we end up blaming the messenger. So I think there's a bit of that. And I also think, you know, it's just humans being humans. We sometimes just don't like the look of people or the sound of people for other reasons as well. So, you know,
Yeah.
I do like the positive feedback. I ain't gonna lie. You know, I do get a lot of nice messages when I meet people, and a lot of young physios say thank you for that. You've given me the desire to stick with the profession that I thought was rubbish and I was going to leave it, but I found that, you know, there's another way through this. We don't have to be such, you know, stuck in the dogma. And then there's, as I say, people that send me messages a little bit differently, full of some hate and nastiness as well. But I would say on general, it tends to be more the positive than the negative.
Yeah, I mean, I think definitely it's good to have. You want to have characters, not friends. You want to just have personality, and like this is a leading question. But you think that the industry does take itself too seriously, and that there's like a very arrogance is maybe a strong word, but just that people know this is it.
Yeah, I think there's two things lacking in healthcare, musculoskeletal healthcare being part of that, obviously. One of them is humor, and the other one is professionalism being weaponized, and people focusing so much on being professional that they forget to be themselves. And that's something that I think has a huge detriment to how we interact, communicate, and help people. And again, it's something I want to try and get therapists happier with. You know, is just to, you know, be yourself, be a human being, be a kind, caring, empathetic, genuine person, warts and all. You know, don't be some cold, sterile clinician, you know, that is ultra professional all the bloody time, because that alienates people. That acts as a barrier to you helping somebody. I think, you know, humans, they resonate with other human beings. And as I say, that includes, you know, a little bit of roughness around the edges, some errors, some mistakes. That actually, I think, allows you to connect and communicate with people. And people trust other people more when they know they're not so up themselves and they're not so arrogant and they are a bit more of a normal human being. And I say to, you know, you don't always have to have the answers. You don't always have to be ultra professional as a healthcare professional. In fact, people sometimes can see through that. They know that you're just bullshitting them. You're making stuff up. And I find, you know, it goes a long way to sometimes say to a patient, being honest and humble and saying, not quite sure what's going on here. I've got a list of suspicions. It could be this, this, and this, and this. But what I do know is that most of this tends to be managed and treated the same way, as the same sort of natural history. So hopefully it's all going to go in this direction that I anticipate. But I think we should try a bit of this first and see how it goes. I find people gravitate to that really well. rather than just being this ultra, I know exactly what's going on, this is exactly what we need to be doing. That sometimes I find, doesn't work well, because when it doesn't go according to plan, you're left with egg on your face. You're looking like a right idiot now. And I say, if you were just that little bit more humble and honest with people at the beginning, you take the pressure off yourself as a clinician. You make sure to tell the patient that this might not work, but we've got plan B and C in the background that we could do. And I think that goes a long way. I think a barrier with that, I say, there's a lot of therapists don't like admitting their uncertainty to other people. Human beings don't like doing it in general. And I think a lot of that is because a lot of people assume when you're uncertain that you don't know anything. And I think it's the exact opposite. I think the more you know, the more uncertain you become. And I find those that are very certain about what needs to be done and which treatment is best, they're the ones that are lacking this broader perspective on things. They're the ones that perhaps haven't read as widely, and they haven't read the conflicting research and evidence, and they haven't heard the other opinions out there. So I always tell therapists, don't be ashamed to tell people about your uncertainty. I think it demonstrates that you're perhaps, say, aware of a lot of other views and opinions out there.
Yeah, and definitely you can see that. Like from my perspective, if I'm in a room where we're talking about something, we talked before about it, I think people do take it very seriously, and it's like, it is serious, of course it is, but you can see certain people are kind of just stood there, just like, you can just tell they don't want to be there, and it's like, well, it's difficult to build any sort of rapport on that anyway. Like, how are you helping people to do that? And like, how do you think it's going? Like, what are you seeing? Any changes in this? Like, what are the differences with the younger physios coming through?
I find a lot of the younger physios are coming out a little bit, well, I came out not well equipped in how to communicate with people. I find communication is something that isn't taught very well. Communication skills, how to interact with a wide, varied population. You have to be a chameleon. You have to have different strategies, different approaches that you can take, because no one communication technique is going to work with everybody that you see. And I think, therapists could do with, at a very early start of their career, training on their communication skills of how to interact with people better, because that's the first starting point of all healthcare assessments. Before you even start to do your muscle testing, your neurophysiological testing, you have to talk to somebody. You have to get the information from them. And your examinations and your technical skills are only going to be as good as the information you gain from that patient. So history. Listen to your patients, talk to your patients better. And it isn't something that I see still now in this day and age being overly focused on in undergraduate training. And it wasn't in my undergraduate training, and that was 25 years ago. And it's still disappointing to see that it still isn't. So I try, my main element on my course that I teach, the first 2-3 hours of it is all communication techniques. It's all about my learning, reading, a couple of courses that I've done on improving communication skills, how to get around those tricky discussions that you have with a patient who's a bit aggressive and a bit defensive, how to open up somebody who's closed and reserved, shy, intimidated, scared to be in your environment. How do you manage to tease information out of somebody in those situations? And so that's what I like to give physiotherapists and other therapists, that little bit of ammunition to be able to do that. And I think that helps massively later on down the line when it comes to your physical therapy interventions and your treatments.
And in terms of the courses then that are ongoing now, how much is that covered? What is the support for helping develop those communication skills?
Yeah, there is things out there for therapists to do. Like I said, we do it on the BCP. So there's, online courses that people do. There's, designated specialized communication courses that you could go on to. There's a wealth of research and information on there about communication as well that, all healthcare providers can read and tap into. So there is resources out there. It's just not given to undergraduates in their training programs. They all have to do it as a postgraduate, after they're in practice, rather than learning it and perfecting it and trying to be as good as it before they start going into practice.
Yeah, I mean that's one of the things that I've picked up from quite a few of the people I've had these chats with. I remember Andy Franklin Miller saying there's such a focus on the academic side of things and high grades and so on. That is from a sports medicine perspective. He said he was really poor at maths, really poor at physics, and he's gone on to do a doctorate in biomechanics. So it's like it's trying to get people at the right time and engage them in the right way. So in terms of like the academic requirements for the course, is there too much emphasis on that as opposed to the general people skills?
I think, again, it's another criticism I have of the university system for musculoskeletal therapists, physios particularly. The grades that you need to go to do your Bachelor of Science in Physiotherapy are not far off than those that you would need to go and do medicine. And I think, to do medicine, you have to have a different level of mindset, skill, intelligence than I think you do to be a therapist. I think the skills and the attributes to be a good therapist are not really the same skills and attributes to be a good medical doctor. And I do think that is something that I find universities haven't really picked up on. They do put these very high academic entry grades onto youngsters who want to do physiotherapy. And I think there's a lot of really good potential physiotherapists out there that just couldn't get onto the courses because they didn't get the academic grades. They've got the right personalities, they're caring, they're empathetic, they're good listeners, they're good communicators, they've just got that natural air about them. And these are the people that I think make excellent physios, excellent therapists, and they're unfortunately not able to get into the courses because of these high demands of academic grades needed. I'm not going to say, you don't need any academic grade. I don't want to let the pendulum swing too far. You do need an element of intelligence to be a physiotherapist. You do need an element of academia, but I don't think you need as much as they stipulate at the moment.
Yeah, well, we had a clinic for 6 years, and before we focused more on the tech and education side, but we recruited people for that. And we never recruited a full-time physio. We went down the sports therapist and sports rehab route because just the people, they just were great people. And like 2 of them or 3 of them are still working with us, 2 sports therapists who were just brilliant, really good, helped with the clinical side, but they're rounded. They just engaged better with what we were doing, and the same with sports rehab. And that's pretty consistent. Obviously, I've met some great physios who are good friends, and it's not a black and white thing, but in general, there was just a very different demeanor for the physios that came through, apart from the rehabbers and therapists.
I've got a lot of time for sports therapists, and I do feel sorry for sports therapists in this country because of the lack of recognition a good sports therapist gets in the healthcare environment. And again, it is something that annoys me hugely is seeing my profession, the physiotherapists, putting themselves at the top of this metaphorical hierarchical system about how they are perceived to be, the top dogs of musculoskeletal therapy. And it frustrates me hugely. Being a physiotherapist for over 20 years, I don't want to come across too disparaging to my own profession, but they don't deserve the reputation as being the ultimate musculoskeletal therapist that a lot of them think they do. That I've come across a lot of stupid, silly stuff that physiotherapists say and do, and some of the practices and the way they interact and treat people is just horrendous. And then I go and see sports therapists who, as you said, have got much different attributes and better communication skills, but because they're not seen as physiotherapists, they can't work in the NHS as easily. Not many patients are aware of them being sources of help and assistance. And I find it's extremely frustrating to see physios lauding it up, pretending to be, above and more superior than sports therapists. I'm like, wind your neck in. You're not, absolutely not at all.
Yeah. Yeah, no, yeah, I do think it's a really interesting topic, and I know they've been promised HCPC for a number of years, but yeah, we'll come round to that. But it's like getting back to you then. So, how did you get involved in this area in the first place?
What, in physiotherapy?
Physio, sport. I know sports sciences. You've got that background as well.
Yeah, well, I sort of got into this sort of in a roundabout way. So when I was at school, I had no ambitions of going into healthcare at all. I wanted to go into the military, and I did for a few years when I left school, very young. I went and did a few years service in the British Army in the Royal Anglians, and I was planning on staying in there for a good long period of time. I was going to hopefully become a career soldier, but as things happen, it didn't go according to plan. And so I left the military and came out onto Civvy Street and didn't really know what to do with myself. So I started off working as an unregulated, unlicensed personal trainer, just starting to help people get fit because the military had made me the fittest I've ever been in my life. So I used that to my advantage. And then I wanted to learn a bit more about it. So I went and managed to blag my way onto a Bachelor of Science degree course in sports science. And my first degree was in sports science, which I thoroughly loved. I really enjoyed my sports science degree. But I came out and couldn't really find a job that was going to use it. So again, I went back into personal training now, but with a bit more qualification. And then eventually found myself thinking, okay, I want to help people with injuries and rehabilitation as well. And I thought, I'd go and seek out the physiotherapy course. And so I did. I did my second degree in physiotherapy, and that's sort of how I got into it.
Yeah. And so, like when you were doing your sports science, then what was it that you actually thought physio would be something that is the next step? I know, having done sports science, it was like you're going to work in a gym or go and teach PE. So that was
Yeah,
basically the options for me.
yeah. Well, I think initially I didn't have any desire to go into physiotherapy, so I was obviously helping people personal training wise becoming fitter. And then I was coming across, as we all do, people that were saying, "Oh, this is sore, this hurts. Is it okay to carry on training?" And you really haven't got quite that much of an idea whether it is or not. And so you'd always say, "Well, you perhaps need to go and speak to your doctor or speak to the physiotherapist." And I thought, well, how about if I train myself up to be a physiotherapist so I can answer these questions? So that's pretty much was my motivation. It just started to pique my interest because I thought, it would be nice to know how to know whether somebody is okay to carry on training in the presence of back pain or knee pain, and what's the best type of rehabilitation protocols and systems to take people through. And then I always had the ambition as well as, the other thing that started playing my mind is, I can go and work in professional sports then as a physiotherapist. I can get the old magic sponge and I can run onto the football field on a Saturday afternoon under the lights and the cameras on Sky TV. So I thought that was another aspiration that I had. So that's what motivated me to go into physiotherapy.
Right. So that was the plan. Was sport was the goal.
Yeah, definitely. I was always into health and fitness, always going to be musculoskeletal. When I was at university and I was having to do my respiratory training and my neurological rehab, and, I was going on placements in ITU departments, I was a fish out of fucking water, mate. I was like, this is not what I had naivety there. I was like, I didn't even know physios did this, sucking phlegm off people's chests. This was completely new to me. So yeah, it was always going to be musculoskeletal. It was always going to be around health and fitness, strength and conditioning, personal training, and sports. That was where I wanted to work in. And as soon as I could, I got a job in a musculoskeletal outpatient department in physiotherapy. Got a static post there, which sort of stopped me having to go onto these ITU wards and do all that sort of stuff. And then it just sort of snowballed from there. Went into private practice, did a few years private practice work, managed to work in a couple of amateur clubs for sports, and then eventually got into professional sport for 3 seasons with Watford Football Club,
Right.
which is where I thought I'd made it. I'd made my pinnacle. I managed to get the old monogram tracksuit, got my appearance on Sky TV. I thought, here we go, made the big time.
So you a Watford fan?
No, no. If I'm being honest, mate, I'm not really a football fan at all. I think I was the worst football physio ever because I was, again, a little bit ignorant and naive to the demands of the sport and what you had to do for it. And I certainly had no starstruckness because, there were these professional football players lauding it around and someone's going, do you know who that is? I'm like, no, that's so and so and so. I'm like, oh, right, okay, who's he then? you don't know that guy? I'm like, no. So, yeah, it was a bit funny at times. I was, as I say, not really that invested into football myself.
Yeah. So what was the driver then to go and do that?
Well, if I wanted to work in professional sports, so if I was being honest, I wanted to get into professional rugby. That's my main sport that I enjoy. So it was a foot in the door, and it was again a mate of a mate of a mate who sort of got me the introduction to the sports medicine team at Watford Football Club. And I managed to go and have a chat with the gaffer and the head of the medical department, and they liked the look of me, liked the sound of me, and offered me this part-time job that I did. And then from that, it sort of snowballed into this full-time second physiotherapy post for the first team, which you say I was like over the moon about. And then I thought, this will then lead on to hopefully other things elsewhere in other clubs and other sports as well. But it didn't. It went very south very quickly with a change in ownership of the club overnight, and we're all suddenly made redundant.
Right.
Surplus to requirements, and that's one of the downsides of working in professional sport. Job security, no, there isn't any.
Yeah.
You have to accept that as part of the thing. So
What was that experience like then when they cleared house?
Yeah, pretty much all the backroom team and staff were surplus to requirements pretty much overnight when the new owners came in. It was Zola who was the new manager, and he had his team that he'd been working with before that he trusted and knew. And I understand, so they didn't need us.
Yeah. And so in terms of then it's like, checked out like where you worked previously then. So in terms of going into rugby and looking into other sports things, was that something, did you actively do that?
Yeah, absolutely. So once I got made redundant, I was on my arse thinking about what to do. And, I got a little payout as well. So, financially, it took a bit of the pressure off. I didn't have to panic about, what I was going to do for the next 6 to 12 months from an employment point of view, which was nice. But, I thought, this now gives me the chance to, start putting my CV out there, start, going around speaking to other, networks and people that I've developed over the 3 years that I've been at Watford, and see if there was anything else going. And I tried, and there just wasn't. There wasn't any other jobs that I could find, not within the area and the location that I was at. And that was the other thing I say to people: if you're getting into professional sport, you have to be open to upping and unrooting yourself from a location. And I couldn't do that because of my wife and family commitments that I had. So I had to find somewhere in and around sort of a drivable area to where I was located. And yeah, it just unfortunately didn't happen. So I went back and worked into private practice again as a physiotherapist.
And then at what point did you start to think about doing your own educational courses and disseminating it? And also in terms of like you have got a unique voice, I would say, in the industry of the way that you communicate things. At what point have you always been like that you just speak your mind and you're being controversial?
Yeah, I don't say I deliberately try to be controversial, but I think, yeah, I do have a tendency for going to find, conversations and debates that are controversial and sticking my two pence in. I sometimes engage my mouth a bit faster than I should do at times as well. And I think that's also part of the controversy that happens, that I get involved in. But, I got into it again a little bit by accident. So when I was made redundant from Watford, I had a bit more time on my hands, and that's where I went on social media. So this is probably back in 2007, 2008. And I just started to explore Twitter. And obviously Facebook had been around for a bit there as well, so I knew of that. But this new Twitter thing I hadn't seen much about. And I went on there and I just saw, there was people out there putting things out there like blogs. And I was like, aren't blogs just what people do to tell other people what they've had for breakfast and stuff like that? And I sort of realized it was a way of just, disseminating information and putting thoughts and opinions down onto paper. So that's what I started to do. Just started to write a few blogs, started to put my thoughts about, some of the frustrations that I've had. One was first ones I did was working in sport with all the nonsense that was around the athletes there and the frustrations that I had sitting in a dressing room waiting for a player to get off a phone call with his agent about booking an appointment to go and see this specialist who's going to help him with his hamstring strain that was somewhere up bloody arse end of England, Leicester way or something. And I had to go and escort this player up there because you can't trust a football player to go anywhere on their own. So part of the medical team has to go with them. And I'm sitting in this specialist therapist's room with the player, and he starts this specialist treatment of his hamstring strain. And I kid you not, he gets out this pulse, I think is the way of describing it, this gooey stuff that's this special concoction of herbs and things that he does, and just literally puts it on his leg, straps it up, and leaves that there for 30 minutes. And I'm sitting here going, I've just wasted a whole day of my life here to go and escort this professional football player to get this specialist treatment for hamstring strain, and they've just stuck this gooey gunk on the back of his leg. I'm like, what the hell is going on here? So, you go back and you report back to the head of the medical department and say that's what's happened, and they're like, yeah, I knew that was going to happen. I was like, well, why are we sending them up there? Well, we got to make sure the player is getting what they want, got to keep them happy, keep them satisfied. I'm like, but it's doing them no good. They've just taken a day out of rehab. They've had a whole day sitting in a car when they could have been doing something a bit more beneficial. So, it's these things that I just wanted to put out there into the wider world about my views and frustrations of working in professional sport. And then I sort of expanded it into other things as well as a physiotherapist that I thought were a bit nonsensical. And that obviously generated a lot of interest and debate, and it sort of, again, snowballed from that.
Yeah, but it was all stuff that you genuinely believed. It wasn't like trying to be controversial then. It was just putting out things that was, well, that is ridiculous, isn't it, what you just said? So it's those sort of statements and that.
Yeah.
How quick did it get traction?
Very slow. Nothing happened quickly on my social media. So again, I get people asking me, how do you develop a following? Tell me the quick fix and solutions. There isn't one. It's something that has just happened slowly, gradually, consistently since 2007. I think the key features with, getting a social media engagement is having some ideas, putting them out there in a clear, presentable way that people can understand without, too much jargon and complicated bullshit around it, being consistent and being open and honest about it. I think these are the key attributes that, helps develop a good social media following, and having a bit of a personality as well. And, not being shy to, defend and stand your ground in your opinions. These things are also good attributes to have on social media. And I think, that's what a lot of people out there with big social media followings have. They're genuine, they're honest, they've got a view and opinion that they stand by, they're consistent. Those are the things that I think a lot of people gravitate towards.
Yeah, I mean, probably in life in general, social media's just kind of advanced it and made it more accessible to everyone, hasn't it? Really, just that anyone can access anything. And you mentioned earlier on about that you respected the people from the past. Like, who are the people that you think have impacted you most, or have had a big influence and impact on you in your career?
Yeah, great question. I think the number one person that I give most credit to, I mean, there's been a few, but the one person that I give most credit to is a physiotherapist who's no longer with us, God rest his soul, is a guy called Louis Gifford. So I don't know if you heard of Louis Gifford.
I've heard the name.
Yeah, he isn't as well known as he should be. And again, it's something that does piss me off a little bit. Out of all the gurus that are out there in this profession, unfortunately, Louis isn't as well known as he could be. And again, I think part of that, obviously, he's no longer with us. But when he was with us, he was a force in physiotherapy. He just unfortunately was shut down and critiqued and challenged a lot by the dogmatic guru culture of physiotherapy out there. He was one of the first critics and skeptics and outspoken individuals, a bit like me, swearing and effing and jeffing around a bit. Had a great personality, but was very, very smart, intelligent, and just genuinely interested in helping people in pain. You could feel that, every time you were seeing him on a course or, with a patient, you could see he just genuinely wanted to help this person to the best of his ability. And again, I think that's a key attribute for a physiotherapist, is you just got that desire to want to help somebody who's struggling with something, help them through that situation. And so I've got to give him a lot of credit for keeping me on the path of the physio profession, because I was very much thinking early on in my career of jacking it all in. The first few years of coming out, I was very disillusioned with the profession. a lot of bullshit and silly nonsense around it, being critiqued all the bloody time by my peers about how I wasn't palpating things correctly, how I wasn't doing the manual therapy techniques right. I was just made to feel worthless, inferior, nearly every day in clinic, and it just got on top of me and got me really disillusioned. And I thought, bugger this, I'm just going to go back into personal training. I'm going to start just helping people move and exercise. And Louis convinced me not to. I went on one of his courses down in Torquay, Cornwall, somewhere, I think. And I was saying on the drive down, I was saying, you know, this is it. This is going to be the last course I'm ever going to go to. I'm going to see what he has to say, and then fuck it, I'm probably going to go back on Monday and hand my notice in. And it was the best course I've ever been on in my life. It was literally awesome. I was sitting there with my jaw on the floor, just going, this guy gets it. This guy understands it. This guy is speaking everything I want to hear. So it was all confirmation bias. And I said to him at the end of the course, as he was wrapping up and everybody was leaving, I was like, I was thinking of leaving the course. I was thinking of leaving the profession, but I've come on this course and you've managed to keep me with it. And from that, again, you just, the type of person he was, he was busy. He needed to go home Sunday evening, end of a course, been working all weekend. He could have just gone, okay, thanks very much for telling me that, fuck off. But he didn't. Took me to one side and spent 10 or 15 minutes with me talking to me. You know, he said, well, tell me a bit about it. Why are you thinking that? What's been going on? And just listening and just being empathetic and just reassuring me that he said, yeah, I've been through it as well. I understand what you're going through. Stick with it. You know, there are ways of being a physiotherapist that you don't have to do all the things that they're telling you to do. So I've got to give Louis Gifford a lot of credit.
Yeah, that's an incredible story. Yeah, it's really interesting. So when you did go back into work that next day, whatever that was, like how big an impact, like how did that change what you were like mentally going in, and then just for the next few weeks?
Yeah, so I pretty much from that almost completely abandoned all my manual therapy treatments and techniques. I pretty much said, this is the stuff that I'm struggling with. This is the stuff that I keep getting critiqued on. This is all the stuff that I find the patients aren't really responding to. So I said, you know, I'm going to stop doing it all. Or I didn't say that overnight. I said, this is the stuff I'm not going to do as much of. And what I'm going to start getting people doing is going back to what I would do as a personal trainer. I'm going to start getting people moving with their pain. And this is what Louis Gifford's approach was. It was about, you know, more about movement based rather than just doing the poking and the pressing and the rubbing and strapping them onto a low level laser machine or a pulse shortwave machine. It was about, you know, that's only a small part of helping people. There's all this other stuff, you know, it's about helping them understand their pain, the information, the knowledge, the education, but just getting people bloody moving. And his course just gave me that confidence to say, I knew this is what I had to do, but there's somebody who's actually now giving me the reassurance that it is the right thing to do. And so I went back and I started to phase out my manual therapy from my practice as a physiotherapist, much to the annoyance of a lot of my managers and peers and a lot of my patients as well. It wasn't an easy transition, that's for sure, because physiotherapy and a lot of the musculoskeletal therapy has this reputation of being, you know, a passive treatment. You go and see a physiotherapist to get something done to you. You're going to feel shortchanged if you go and see a physio and you don't have a 20-minute back rub, or you don't have something pushed or pressed, or you don't have a machine strapped onto you. And so trying to navigate that and work around that in the early 2000s was very, very challenging. And I did feel like a fish out of water because there wasn't many of us out there doing that. And it wasn't easy.
Yeah, that's really interesting. Yeah, I mean, what if you hadn't gone on that course, you know, it would have completely changed everything you're doing potentially there. Then.
I think so. Yeah, I look back at this every now and again when people ask me questions like this, and I absolutely genuinely think if I didn't go on that course, I wouldn't be sat here as a physiotherapist 20 years later.
Yeah. Yeah, maybe it'd have been better. Who knows?
Yeah, I'm thanking Louis. I don't know whether I should be actually saying, bugger you, Louis, look what you've done to me.
Yeah. No, it is interesting,
I could have been
it?
a tree surgeon. I could have been chopping trees down or something done in nature. Yeah, absolutely.
Yeah, no, it is interesting, like just how these things can just completely change the way that you view things, and Yeah, people do have these massive things like 10 or 15 minutes is you thought of it as a massive thing from your side, but from his side, it is big, but also that's changed someone's life basically. So in whatever capacity it is.
Yeah, and one of my biggest regrets is that I don't think he knows it. I mean, we met a few other times after that, and I sent him some messages via email every now and again as well, and he was kind enough to respond. But I do feel guilty that I never explained to him how much of an impact he had onto me, and to say unfortunately died in 2012, 2013, I think. And yeah, I just wish I managed to, perhaps send him an email to say you've been such a massive influence and inspiration on me. So it's a little bit of regret that I've got there that unfortunately passed away before I could tell him that. But I'm sure he doesn't care. He's up there now, probably smoking a spliff, having the time of his life. And he's probably looking down and not worrying too much about physiotherapy. I'm sure of that.
Yeah. Yeah. And like, what would you say if you were, well, for people who are having doubts about maybe wanting to carry on doing something, because I'm sure a lot of people are going through different issues with things, like how would you help them? Because you can't bump into everyone and have that conversation with them. But like, what would your advice be for people that are maybe having doubts about working in this area?
Yeah, I don't know what I could say here, but I think the main thing is don't make any rash decisions. Take some time, think things through, try to look at different perspectives. Is it as bad as you think it is? Is it just a rough patch? Is it due to things that are in your control or out of your control? If there are things that are in your control that you can work on to improve the situation, then try to address those. If there are things out of your control and you've thought about it long and hard and you realize that there's no way that things are going to change, or there's no perhaps signs that things are going to change, then maybe you do have to consider moving on to pastures new for your own health and well-being as well. And I know that can be scary and worrying and concerning and unnerving to do. But it's a big wide world out there. There's lots of options and opportunities out there that are open to you, and you don't have to stay in one area just because you feel trapped. There are things that you can do and use your skill sets elsewhere. It doesn't even have to be a complete change of profession. There are other avenues in this healthcare world that you could look into, that you say your skill sets might be better aligned for, the environments may be more conducive to a more satisfying way of life. So yeah, just think about things. That's, I think, the key thing. Analyze, think, critique stuff.
And like, have you've had some issues recently with some of the case that you've been going through and those things? How has that affected the way you've thought about what you want to do?
It's been another motivator for me wanting to leave the profession again. So yes, this situation I find myself in with complaints against my so-called professionalism on social media, because I am swearing a bit now and again. I use it to get a bit of emphasis, a swear word. I don't use it to attack and abuse anybody. So none of the complaints are coming from patients. They're all from other physiotherapists who have felt upset and offended at my behavior on social media. And it's just, it has got to me where I've realized, there's people out there that are malicious and vindictive and jealous, and they will try to shit on you and ruin your life and career. And they've played a game very well, and they've weaponized the system really effectively. And it has forced me to consider saying the only way out of this that I can see is to leave the profession, is to get out of these so-called professional disciplinary hearings for swearing, by just not being a physiotherapist anymore. And then they won't have any legal hold over me. But then part of me thought, well, that's then, giving up. That's sometimes, keeps me motivated to not let these individuals win, for want of a better description. Now, I'm not going to say I don't want to play the victim card here. I'm not totally without blame. All right, I have made some mistakes on social media. I have been too harsh and aggressive to people. And in hindsight, you know, when I look back, I perhaps didn't have to say things that I did say. But that's just being a human being. You know, we've all done that in situations and on social media, I'm sure. But is it really worth the time, the money, the aggravation to go through over 5 years of legal proceedings just because I pissed somebody off on social media? And this is the system that's supposed to be protecting patients. It's not really the system that's supposed to be policing inter-physiotherapy disagreements. You know, I just feel that that's really not where our professional associations should be spending their time and money, yet they seem to be doing a lot of it, which is unfortunate. You know, they should be out there helping protect the public from shysters and charlatans, you know, people that are doing nefarious things under the guise of physiotherapy, not policing physiotherapists' disagreement because two of them don't like the look of each other, or they've said something on social media a couple of years ago that the other person didn't like. So yeah, it has got on to hopper me a bit, and it's still going to be going on for a few more years from what I've been told by my legal team, my legal support team. It's not going to finish shortly. It keeps on going as well because I think more people have realized they can use this against me, and it has been weaponized very effectively. So I probably think I'm going to retire as a physiotherapist still with legal proceedings going on about how I've used social media. I'm sure it will happen.
So 5 years already.
Yeah, that's when the first complaint was made, and then it's just been a snowball effect there. So it seems to be a little pact, quite a big pact now of people that have gone around all giving each other the idea of how to do this, and they've gone through my social media over the years, finding things, taking them out of context, making complaints about it, sometimes blatantly lying about things as well, which is really frustrating, which I've then got to, you know, find evidence to prove they're lying against it. And it's, you know, the process I think that a lot of them want is to put me through this, knowing that it's going to take up my time, energy, and effort to defend myself against these accusations. I don't think they're actually concerned about the outcome of the actual hearing itself. Their little bit of satisfaction is coming through knowing that they've tied me up in this legal hoo-ha for the last 5 years, and probably for another 5 years in the future, if not longer. That's their motivation for doing it. They don't care about the outcome because, you know, I mean, theoretically, I could get kicked off out of the physiotherapy department for saying the F word on social media, but I doubt it will happen initially. Well, that's what my legal advice is saying. I'll probably get a written warning, and then obviously, you know, the more written warnings you get, then the more bigger the sanctions could be. And I think that's exactly what they're trying to do. They just keep trying to add more and more complaints, and they find more and more people that I've pissed off over the years to keep levying these complaints to try and show a pattern of care. And it just seems to be a malicious attempt to kick me out of the profession at some point.
Yeah. No, I mean, as we were saying before we started recording, there's a lot of other stuff going on outside of life for everyone, and life is too short to be like kind of sucked into these things. So yeah, sorry you having to go through that, because it's yeah, I can imagine it is very stressful.
I appreciate it. And again, I don't want to play the victim card. It's not all without any fault of my own. I'll put my hands up there and say there are things.
So yeah, no, I appreciate your acknowledging that you've got some blame in it, or whatever you want to call it. So yeah, hopefully you find something to resolve it and you can feel positive and move forward with everything.
Thanks, mate.
Yeah, no problem.
Time will tell.
Time will tell. Yeah, well, there is more important things, as you said before, in terms of this stuff. And I do feel like there's a lot of people, maybe in life as well, just do take things very, very seriously. And really, for me, is like when I'm running my company, I want it to be a good laugh. I want to do a great job. But ultimately, it's got to be fun, because what is the point in anything? Because anything can happen at any point. So yeah, that's my 2 penneth on it. So like, last couple of questions now. Like, what would your advice be to people thinking about getting into this industry? When we've touched on some quite serious topics there, but what would your thoughts on it be?
Yeah, this is a great job to work in. As much as I've been talking about my frustration, negative aspects of it, there is nothing like helping somebody through a tough patch with a back problem, dislocated shoulder, and seeing the process through of getting this person who's perhaps lost trust and faith in their body, never think they're going to be able to achieve the things that they want to achieve again, and getting them back to that. It's one of the most rewarding, satisfying feelings ever when that happens. And so it is a great profession to work in. All I will say is that when you get into this job, there is a lot of bullshit you have to wade through first to get into a position where you can comfortably do that in a rational, sensible, pragmatic, honest and evidence-based way. There's just a lot of bullshit to get through to get to that situation and that position. And I think that's disappointing, because the profession could help people a lot easier to get into these rewarding positions and jobs sooner and faster. But because they are, again, a little bit slow in the uptake, there's that sticking to the dogma that we talked about earlier on situation. I would say it takes most physios a good couple of years of clinical practice before they actually feel like they're in this rewarding, satisfying, fulfilling job. They've got this bullshit to wade through first. There's a lot of cognitive dissonance. There's a lot of unlearning of things, which all adds confusion and uncertainty to a lot of young physios. So I always say to any young physio, keep a critical, skeptical, open mind about everything that you're being taught. Don't lap up all the bullshit that your professors and your tutors are teaching you. Listen to them. Take on board the information they're giving you, but critically think about it. Go and read around it. Make sure that what they are telling you is correct or factual as best as you can work out. Don't just assume what you're being taught is, because that's not always the case.
Yeah, I think that's good. And then, like, for you, how do you switch off from life in general?
Yeah, at the moment, boxing is my escape, mate. So
I've been following some of it down there. Obviously, you do work out a lot. How much time do you dedicate to doing fitness?
I work out every day, so I try to have my 60 to 90 minutes a day as my escape. Either say doing some boxing, doing a run, or pushing some tin and some metals around. So I try to do that every day. Practice what I preach. It's a philosophy that I've had early on in life. From the military days, personal training days, sports science days. I've always done it. I enjoy it. I like it, and I think it has so many positive benefits, not just for physical health but mental health as well. So definitely. Again, it's something I'm big on advocating to, not only patients I see, but also healthcare professionals, physios as well. Exercise for yourself on a regular basis.
Yeah, no, for sure. Who's your favorite boxer?
Oh, that's a good question. Well, I've got to go homegrown, I suppose. The Watford lad, old Anthony Joshua. Since he had his win, that's got to be one of them up there. But of technical boxer, I'm going to say Jerome Ennis. I think he's an amazing one. Yeah, Ben Whittaker. He's coming through. I know there's been a lot of criticism about his showboating, but he's got some amazing footwork and head speed. Absolutely awesome foot speed there. But whether he'll be able to hold up in the big leagues is still to be seen. I think in his career, he's entered into it a little bit late. He's a very good amateur boxer, and has obviously gone into the professional realms a lot later than most would have done. So whether that's going to be a negative aspect to him or not, I don't know. And I think his chin needs to be tested, as I say, with a decent opponent to see whether he can hold up. But yeah, he's entertaining to watch, and I think that's part of sport as well. It's not just the physicality of it; it's the entertainment factor as well of it.
Yeah, certainly boxing, isn't it? That's a massive component. The showbiz side of it is huge, isn't it? And it's interesting. Like Anthony Joshua gets such praise from like Rob Madden or Ian Gatt, the people that work with him. They say so what a good guy he is as well, which definitely does stand up. I've not heard of Jerome Ennis until quite recently, but then he's since the Ryan Garcia fight at the weekend, like, because he's part of Eddie Hearn's stable, isn't he, Jerome Ennis?
Yeah, he was potentially going to be lined up for his next opponent, because I think O'Brien Garcia's dad gave Eddie Hearn a bit of grief in the corridor until Eddie Hearn said, "How about he fights Ennis?" And that piqued his ears up, and he was like, "Oh, okay, yeah, sounds good." That would be a great fight, Garcia versus Ennis. That would be a really entertaining fight.
Yeah, and what are your thoughts on the Fury Usyk fight?
Yeah, I do think Usyk's probably going to do it personally. Again, with that sort of, weight behind it can go either way. One punch can change the fight completely. But I do think Tyson Fury, well, again, you never know with him as well, do you? But I do think Usyk will probably do it this time.
But I mean, Fury, what a fascinating story it is with Fury. And look what he was when he was at Sports Personality, when he'd beaten Klitschko, and he was just absolutely vilified.
Yeah.
BBC basically almost wouldn't have him on the show, and now he's an absolute national hero.
Yeah, and again, I think, part of it, he doesn't help himself sometimes. I know he's an entertainer and stuff along those lines, but, sometimes he does push the realms of the boundaries of entertainment versus his views and opinions on things and his mannerisms. That hasn't helped things a bit. But yeah, he's an entertainer. He's a character. He's a personality, and he's a bloody good boxer as well. And the other thing I like about Fury is he doesn't look like a good boxer. Yeah, that is always interesting to see. The world heavyweight champion looking nothing like you would expect at all, physicality wise. And again, I think that's a beautiful way to know, that you can achieve things just even though you don't look like you fit the standard model.
Yeah, no, for sure. No, look, I really appreciate your time, Adam, on this. Good luck professionally. Good luck with everything going on in your personal life as well. And
Thanks,
I look forward to catching up soon.
Cheers, Andy. Appreciate the talk, mate.
Thank you.